Every year, thousands of older adults end up in emergency rooms after taking a medication they believed was completely harmless. One of the biggest surprises? Many of them never saw it coming. Because the medicine wasn't new. It wasn't expensive. It wasn't experimental. It was sitting in their own medicine cabinet. And that's the problem. If you're over 65, or you love someone who is, what you're about to hear could help protect something far more valuable than a good night's sleep. Your memory, your balance, your independence. Here's what surprised even many doctors. One of America's most familiar allergy medicines has been linked to confusion, dangerous falls, memory problems, and even a higher risk of cognitive decline in older adults when used regularly. According to years of medical research and expert prescribing guidelines, that changes everything. I'm Dr. Michael Carter, and after decades of caring for older adults, I've learned that the medications people worry about the least are often the ones we need to talk about the most. Before we go any further, I'd love to hear from you. How old are you? And have you ever taken Benadryl for allergies, itching, or to help you sleep? Leave your answer in the comments. I read as many of them as I can, and your experience may help someone else who is watching today. Now, here's the question that kept coming up in my clinic. If Benadryl has been sold for decades, if millions of people have taken it, why do so many doctors now tell adults over 65 to avoid it whenever possible? The answer isn't as simple as you might think. In fact, what happens inside the aging brain changes the entire story. Later, I'll explain why one common bedtime habit may quietly increase the risks without most people realizing it. We'll also look at the official medical guidance that changed how many healthcare professionals think about this medication, and the safer options many older adults discuss with their doctors instead. But stay with me, because the number one reason shocked even me. And once you understand it, you'll never look at Benadryl the same way again. If there's one thing I've learned over the years, it's this. Most serious medication problems don't begin with a dangerous drug. They begin with a familiar one people trust without a second thought. Benadryl falls into that category for many families. For decades, it has been the medicine people reached for when allergies flared up, when mosquito bites wouldn't stop itching, or when sleep became difficult. It became so common that many people assumed if it's sold over the counter, it must be safe for everyone. Unfortunately, aging changes that equation, and that's where the hidden danger begins. Think about your brain for a moment. Imagine it as the control center of a busy city. Every memory, every movement, every conversation depends on billions of nerve cells sending messages back and forth at incredible speed. One of the most important messengers is a natural chemical called acetylcholine. It helps you think clearly. It helps you remember names. It helps your muscles respond. It even plays a role in keeping your balance. Now imagine someone slowly turning down the volume on those messages. Not all at once, little by little. That's very close to what can happen when medications with strong anticholinergic effects are taken, especially by older adults. Benadryl is one of those medications. Here's what surprised researchers. As we age, the brain becomes more sensitive to medicines that block acetylcholine. At the same time, our kidneys and liver often process medications more slowly than they did decades earlier. That means a drug that leaves a younger person's body fairly quickly may stay in an older person's system much longer. The result? Stronger effects, longer-lasting effects, sometimes unexpected ones. Recent research and expert prescribing guidelines have consistently warned that older adults are more likely to experience confusion, excessive drowsiness, blurred vision, constipation, dry mouth, and urinary retention from medications like Benadryl. These effects may seem minor by themselves, but together, they can dramatically increase the risk of falls, hospital visits, and loss of independence. And that's what worries me most. I've seen patients who believe they were simply getting older. They blamed themselves for forgetting appointments. They blamed themselves for feeling unusually tired. They blamed themselves for becoming unsteady on their feet. Yet sometimes, the medication was quietly making those problems worse, not causing every symptom, but adding weight to an already fragile system. Here's an example. Margaret was 81 and fiercely independent. She still drove herself to church every Sunday and never missed her weekly bridge game. During allergy season, she began taking Benadryl most evenings because it also helped her sleep. At first, everything seemed fine. Then, little changes appeared. She overslept more often. She felt groggy in the morning. She misplaced everyday items. One afternoon, she became dizzy while getting out of bed and suffered a fall that fractured her wrist. Her family feared the worst. Was this dementia? Was it simply old age? When her healthcare team carefully reviewed every medication she was taking, they discovered Benadryl was one important piece of the puzzle. Under her physician's guidance, a safer treatment plan was chosen. Over the following weeks, her daytime alertness improved, and the morning grogginess became much less noticeable. The good news? Many medication-related problems can improve once they're recognized and addressed with the help of a healthcare professional. But here's the part that surprises almost everyone. Benadryl isn't only found in allergy medicine. It's hidden inside many popular nighttime sleep aids and combination cold medications, meaning some people take it without even realizing they are doubling their exposure. And that makes the next section especially important, because one of the most common reasons older adults take Benadryl has almost nothing to do with allergies, and everything to do with sleep. 9. The sleep trap. For many older adults, it doesn't start with allergies. It starts with one restless night, then another, and another. Soon, someone offers what sounds like a simple solution. Just take a Benadryl. It'll help you sleep. Millions have heard that advice. Many still follow it. But this is where good intentions can become dangerous. Here's why. Benadryl contains an ingredient called diphenhydramine. While it's sold as an allergy medicine, one of its strongest side effects is drowsiness. That's why it's also found in many over-the-counter sleep aids. At first, it seems to work. You feel sleepy. You fall asleep faster. Problem solved. Or so it seems. But sleep isn't just about closing your eyes. Your brain follows a carefully organized cycle every night. During deep sleep, it repairs cells, strengthens memories, balances hormones, and clears away waste products that naturally build up during the day. Think of it like a housekeeping crew working the night shift. If that crew can't do its job properly, yesterday's mess carries into tomorrow, night after night. Research suggests that while diphenhydramine may make people feel sleepy, it does not produce the same quality of restorative sleep that your brain needs. In many older adults, it can actually reduce alertness the next day while leaving them feeling as though they never truly rested. That's the hidden cost. I've seen this more times than I can count. Robert, a 79-year-old retired teacher, told me he had been taking an over-the-counter sleep medicine almost every night for nearly 2 years. It works, he insisted. But when I asked more questions, another story emerged. He woke up exhausted. He forgot appointments. He struggled to concentrate during conversations. His daughter noticed he repeated the same stories. He thought aging was catching up with him. He never suspected the medicine beside his bed. After reviewing his medications with his physician, they developed a different plan to address his insomnia. It wasn't an overnight miracle, but within several weeks, Robert reported feeling more alert in the mornings and less mentally foggy during the day. His family noticed it too. That mattered. Recent clinical guidelines, including recommendations from experts in geriatric medicine, advise against using diphenhydramine as a routine sleep aid for adults over 65 because the risks often outweigh the short-term benefit. Better approaches may include identifying the underlying cause of insomnia, improving sleep habits, or discussing safer treatment options with a healthcare provider. The important point isn't to suffer through sleepless nights, it's to find the right solution. Not just the quickest one. If you've been relying on Benadryl to sleep, don't stop it suddenly without first speaking with your doctor or pharmacist. Instead, ask a simple question. Is there a safer option for someone my age? That conversation could make a meaningful difference. The good news? Many older adults discover that once the real cause of their poor sleep is addressed, they no longer need medications that leave them groggy the next day. But sleep is only part of the story. What concerns me even more is what can happen the moment your feet touch the floor the next morning. Because the next risk doesn't happen in bed, it happens in a split second. And for thousands of older adults every year, it changes life forever. 8. The fall that changes everything. Most people don't think about falling until it happens. It takes less than a second. One misstep, one moment of dizziness, one trip to the bathroom before sunrise, and life can change forever. This is one of the reasons doctors worry so much about Benadryl in older adults. Not because it always causes a fall, but because it quietly increases the chances. Here's how. As we age, our bodies naturally become more sensitive to medications that affect the brain. Benadryl can cause drowsiness, slower reaction time, blurred vision, and poor coordination. It can also lower alertness long after a person thinks the medication has worn off. The danger is often greatest the next morning, not the night before. Imagine trying to walk across your living room while wearing glasses that aren't quite the right prescription. Your vision isn't completely blurred. Your balance isn't completely gone. But everything feels just a little off. That tiny difference is sometimes all it takes, and that's enough. According to the Centers for Disease Control and Prevention, falls are one of the leading causes of injury among older adults. Every year, millions of Americans aged 65 and older experience a fall, and many suffer serious injuries such as hip fractures or head trauma. What's most heartbreaking is this. Many of those falls begin with something preventable. I've seen it happen. Helen was 84. She lived alone. She was proud of it. She still watered her garden every morning and baked cookies for her grandchildren every Sunday. One spring, allergies kept her awake, so she started taking Benadryl before bed. She didn't notice anything unusual at first. Then one morning, she woke before sunrise. Still sleepy, still groggy. She stood up too quickly. As she walked toward the bathroom, she lost her balance. The fall lasted 1 second. Recovery took nearly a year. After surgery and months of rehabilitation, Helen eventually returned home, but she never regained the same confidence she once had. What affected her most wasn't the broken bone. It was losing the freedom to do simple things by herself. That's what many families fear. Not just the injury, the loss of independence. Recent research consistently shows that medications with strong anticholinergic and sedating effects are associated with a higher risk of falls in older adults, especially when combined with other medications that also cause drowsiness or lower blood pressure. And that's another hidden problem. Many seniors aren't taking just one medication. They're taking 5, sometimes 10, sometimes even more. Each one may seem harmless on its own. Together, they can magnify each other's effects. Doctors call this polypharmacy, using multiple medications at the same time. It doesn't automatically mean something is wrong, but it does mean every medication deserves a careful review, especially Benadryl. If you or a loved one has had a recent fall, or even a few close calls, it's worth asking your healthcare provider or pharmacist to review every prescription, over-the-counter medicine, and supplement you're taking, not to stop them, but to make sure they still make sense today. The good news? Sometimes reducing just one unnecessary medication can improve alertness, balance, and confidence more than people expect. But the next concern is even quieter. It doesn't break a bone. It doesn't leave a bruise. Instead, it slowly affects the organ many older adults fear losing the most, the brain. And what researchers have discovered over the past decade has sparked one of the biggest conversations in geriatric medicine. 7. The memory warning few people expect. For many older adults, this is the fear that keeps them awake at night. Not wrinkles, not gray hair, forgetting the name of a grandchild, getting lost on a familiar road, walking into a room, and not remembering why. We've all done that once in a while, but when it happens more often, it's unsettling. And that's where Benadryl enters a much bigger conversation. Here's why. Your brain depends on a chemical messenger called acetylcholine. Think of it as the brain's internal communication system. It helps nerve cells talk to one another so you can learn, remember, focus, and make decisions. As we get older, those communication lines naturally become less efficient. Then imagine someone turning down the signal even more. That's what medications with strong anticholinergic effects can do, including Benadryl. That matters. Researchers have spent years studying whether repeated exposure to these medications could affect memory over time. While studies cannot prove that Benadryl directly causes dementia, they have consistently found that long-term use of medications with strong anticholinergic effects is associated with a higher risk of cognitive decline in some older adults. That's an important distinction. Association does not necessarily mean causation, but it is strong enough that many geriatric specialists take it seriously. One study that received widespread attention followed thousands of older adults for several years and found that people with the highest cumulative use of strong anticholinergic medications had a greater risk of developing dementia than those with little or no exposure. What surprised researchers even more was that the risk appeared to increase with higher total exposure over time. Not just one dose, not one bad week. The bigger picture. I've had conversations with families that began like this. Doctor, Mom just isn't herself anymore. She's forgetting little things. Could this be Alzheimer's? Sometimes the answer was yes. Sometimes it wasn't. And sometimes, after carefully reviewing every medication, we discovered that one or more drugs with anticholinergic effects were contributing to the confusion. I remember James. He was 76. A retired engineer. He loved crossword puzzles. He never missed one. Over several months, he noticed it was taking longer to find simple words. He misplaced his reading glasses almost every day. His wife became worried because he repeated questions during dinner. Naturally, both of them feared the worst. After a thorough evaluation, his physician reviewed every medication in his cabinet. Benadryl was one of several medicines with anticholinergic effects that he had been using regularly. Together, they created a plan to reduce unnecessary exposure and treat his symptoms in safer ways. Over the following months, James felt more mentally alert. Not every memory problem disappeared, because aging itself still plays a role, but the constant mental fog improved enough that he was back to finishing his crossword before breakfast. His wife noticed the difference first. Sometimes families do. The lesson isn't that every case of forgetfulness is caused by a medication. Far from it. Memory changes can have many causes, including poor sleep, vitamin deficiencies, thyroid problems, depression, stroke, and neurodegenerative diseases such as dementia. That's exactly why it's so important not to guess. If you notice new confusion or worsening memory, don't assume it's just getting older. And don't panic. Instead, ask your healthcare provider for a complete medication review. Bring every prescription, every over-the-counter medicine, and every supplement. You might be surprised by what they find. The good news? Some medication-related cognitive side effects can improve when the underlying cause is identified and managed appropriately under medical supervision. But memory isn't the only part of the brain affected. There's another warning sign that families often mistake for normal aging. It can appear almost overnight. Someone who has always been calm suddenly becomes confused, disoriented, even frightened. And when that happens, it can become a true medical emergency. 6. Sudden confusion is never just old age. This one can happen fast, very fast. One day, everything seems normal. The next day, an older adult is confused. They don't recognize familiar faces. They can't follow a simple conversation. They seem frightened or unusually agitated. Families often ask the same question: is this dementia? Not always. And that's a critical difference. Dementia usually develops gradually over months or years, but delirium, a sudden state of confusion, can develop over hours or days. It is a medical condition that needs prompt attention because it often signals that something has gone wrong inside the body. Sometimes it's an infection, sometimes dehydration, sometimes an electrolyte imbalance, and sometimes a medication is part of the problem. Benadryl is one of the medicines known to increase the risk of delirium in older adults because of its strong anticholinergic effects. When an aging brain is already more vulnerable, blocking acetylcholine can make it much harder for the brain to process information normally. It's like trying to tune into a radio station. The signal is already weak. Then, someone adds static. Soon, it's difficult to hear anything clearly. That's what the brain can experience, and it can be terrifying. I've seen family members walk into a hospital room in tears because their father or mother suddenly seemed like a different person. One moment, they were carrying on a normal conversation. Hours later, they were convinced they were somewhere else, or insisting people in the room weren't really there. It was frightening for everyone. I remember a patient named Eleanor. She was 82 and recovering well after a minor surgical procedure. Everything looked encouraging during the first day. Then, the following evening, she became restless. She couldn't remember where she was. She tried to climb out of bed because she believed she needed to go home and feed the children who were now in their 50s. Her daughter was devastated. She whispered to me, "Has Mom developed dementia overnight?" The answer was no. After a careful evaluation, the medical team identified several contributing factors, including medications with anticholinergic effects. As those issues were addressed and her treatment plan was adjusted, Eleanor gradually became herself again over the next few days. Her smile returned. So did her sense of humor. That was a tremendous relief. This is why healthcare professionals take sudden confusion so seriously. It's often reversible, but only if the underlying cause is recognized quickly. That's why experts, including geriatric specialists, encourage reviewing medications whenever an older adult develops new confusion, especially after starting a new medicine or increasing a dose. If you ever notice that a loved one becomes suddenly disoriented, unusually sleepy, hallucinates, or cannot stay focused, don't dismiss it as just aging. Call their healthcare provider right away or seek urgent medical care if the symptoms are severe or develop rapidly. Time matters. The good news? Many cases of medication-related delirium improve once the cause is identified and treated appropriately. But here's what many people never realize. The brain isn't the only organ affected by Benadryl. There's another hidden consequence that starts much lower in the body. It can make everyday activities uncomfortable, embarrassing, even dangerous. And many older adults never connect it to the little pink pill they've been taking for years. 5. The hidden problem that can send you to the hospital. This one rarely makes headlines, yet I see it far more often than people expect. It doesn't begin with pain. It begins with discomfort, a dry mouth, difficulty urinating, constipation that seems to get worse each week. Most people shrug these symptoms off. They assume it's simply part of getting older. Sometimes it is, but sometimes a medication is quietly making things much worse. And Benadryl is one of the medicines that can do exactly that. Here's why. Acetylcholine doesn't just help your brain. It also helps many organs throughout your body work properly. It tells your bladder when it's time to empty. It helps your intestines move food through the digestive tract. It stimulates saliva that protects your mouth and helps you swallow. When a medication blocks acetylcholine, those normal body functions begin to slow down. That's when problems can appear. Think of your digestive system like a long conveyor belt. When everything is moving at the right speed, food passes through normally. But if someone slows the motor, everything backs up, little by little. That's exactly what can happen in the intestines. Constipation becomes more than an inconvenience. It can become severe. In older adults, severe constipation may lead to abdominal pain, poor appetite, dehydration, and in some cases, hospitalization if left untreated. The bladder can be affected too. Instead of emptying completely, urine may remain trapped inside. This is called urinary retention. It can be painful. It can increase the risk of urinary tract infections. And for men with an enlarged prostate, a very common condition after age 65, the risk may be even greater. I've seen this happen more than once. George was 78. He had seasonal allergies and occasionally took Benadryl at night. A few days later, he noticed he couldn't empty his bladder normally. At first, he ignored it. He thought he simply wasn't drinking enough water. By the following evening, the discomfort had become intense. His wife drove him to the emergency department, where doctors found that he was experiencing acute urinary retention. After treatment, his symptoms improved, and his healthcare team reviewed all of his medications. Together, they discussed alternatives that were less likely to cause the same problem in the future. George later told me something I've never forgotten. I wish someone had warned me this could happen. So do I. Dry mouth may seem harmless, but it has consequences too. Saliva protects your teeth, helps control bacteria, and makes swallowing easier. When your mouth stays dry for weeks or months, the risk of tooth decay, gum disease, mouth infections, and difficulty eating can increase. For someone already struggling to maintain weight or nutrition, that becomes a much bigger issue than people realize. The good news? These side effects are often recognized early and can frequently be managed by reviewing medications with a healthcare professional and considering safer alternatives when appropriate. That's a conversation worth having, especially if you've noticed worsening constipation, difficulty urinating, or persistent dry mouth after starting a medication. But there's another hidden danger that's even easier to overlook. It doesn't cause pain. It doesn't always make you feel sick. Instead, it quietly builds as medications begin interacting with one another. And for many older adults taking several prescriptions each day, that's where the real risk begins. 4. The medication combination that no one warns you about. Here's a question I often ask my older patients. Can you tell me every medication you're taking? Many smile. Then they start counting. 1 for blood pressure, 1 for cholesterol, 1 for diabetes, 1 for arthritis, something for sleep, an allergy pill, a cold medicine, a pain reliever. Before long, the list is much longer than they expected. And that's where Benadryl can become far more dangerous than it appears. Not because of what it does alone, but because of what it can do with other medications. This is one of the most overlooked problems in older adults. Each medication may have been prescribed or purchased for a good reason, but the body doesn't experience them one at a time. It experiences them all together. Think of it like adding small weights to a backpack. One weight doesn't seem like much. Neither does the second or the third. But eventually, the backpack becomes too heavy to carry. The same thing can happen inside the body. Benadryl can add to the effects of other medications that cause drowsiness, dizziness, or confusion. That includes certain sleep medicines, some anxiety medications, opioid pain relievers, muscle relaxants, and even a few medicines used for nausea or bladder problems. Each one may contribute only a little. Together, the effects can multiply. That's what makes this so important. I've cared for patients who insisted they had never had a problem with Benadryl. And they were right, until a new prescription was added. Then everything changed. I remember Linda. She was 74, active, independent. She had taken Benadryl occasionally during allergy season for years without much trouble. Then she developed back pain and was prescribed a short course of a muscle relaxant. Neither medication caused major problems by itself, but together, she became unusually sleepy. Her speech slowed. She nearly nodded off while eating dinner. Her daughter noticed immediately. Fortunately, they contacted her physician before anything more serious happened. After reviewing her medications, her doctor adjusted the treatment plan, and within a few days, Linda was back to feeling like herself. That quick phone call may have prevented a much more serious event. This is exactly why healthcare providers encourage older adults to keep an up-to-date list of every medication they take. Not just prescriptions, everything. Over-the-counter medicines, sleep aids, allergy pills, herbal supplements, vitamins, even products you only use once in a while. Because sometimes the biggest clue is hiding in plain sight. One of the most helpful habits I've seen is bringing every medication, often called a brown bag review, to a doctor's appointment or pharmacy consultation. Seeing everything together makes it much easier to spot combinations that may increase risk. It sounds simple, because it is, and it works. The good news? Many potentially harmful interactions can be avoided before they ever cause a problem. Sometimes all it takes is one conversation with your doctor or pharmacist, one review, one adjustment, one safer choice. But we're not finished yet. The next reason Benadryl concerns so many geriatric specialists has nothing to do with drug interactions. It has to do with something every older adult experiences, aging itself. Because as the body changes with time, the very same dose you've taken for years may no longer be the same dose your body experiences today. 3. Your body has changed even. If the dose hasn't, here's something that surprises almost everyone. The Benadryl tablet hasn't changed, but your body has, and that makes all the difference. Many older adults tell me, "I've been taking this for 20 years without a problem." I believe them, but I also remind them of one important fact. You're not the same person you were 20 years ago. None of us are. Aging changes the way the body handles medications. Slowly, quietly, almost invisibly. Your liver, which helps break down many medications, may work more slowly than it once did. Your kidneys, which help remove medications from the body, often become less efficient with age. Even if your kidney function is still considered normal, it may not clear certain drugs as quickly as it did when you were younger. That matters, because when a medication stays in the body longer, its effects can last longer too. The drowsiness may linger into the next morning. The confusion may be more noticeable. The dizziness may appear when you least expect it. Think of it like pouring water into a sink. When the drain is wide open, the water flows away quickly. But if the drain becomes narrower over time, the same amount of water stays in the sink much longer. Your body can work the same way with certain medications. The dose hasn't increased, but your exposure has. That's why a pill that seemed harmless at age 45 can affect you very differently at age 75. I've seen this play out many times. Charles was 80. He laughed when I asked about Benadryl. "I've taken it since my kids were little," he said, "so I know it agrees with me. At least, it used to." Over the previous year, he'd begun waking up feeling unusually groggy. His balance wasn't as steady, and he often needed an afternoon nap, something he'd never done before. He assumed it was simply part of aging. But after his healthcare provider reviewed his medications, they realized that changes in his body, combined with several prescriptions, meant Benadryl was affecting him much more than it had years earlier. Together, they chose a different approach. A month later, Charles told me something I'll never forget. "I thought I was getting old. I didn't realize I was getting over-medicated." Those are two very different things. Of course, not every symptom of aging is caused by a medication. Far from it. Growing older naturally brings changes in energy, balance, and memory. But medications can amplify those changes. And that's why regular medication reviews become more important with every passing year. Experts often recommend that older adults ask their healthcare provider or pharmacist to review all of their medications at least once a year, or anytime a new prescription is added. It's one of the simplest ways to reduce unnecessary side effects and make sure each medication is still the best choice. The good news? Sometimes the safest treatment isn't adding another pill. It's reconsidering one that's no longer the right fit. And now we've reached one of the most misunderstood reasons Benadryl remains so common. People don't always buy it as Benadryl. In fact, many don't even realize they're taking it at all. And once you know where it's hiding, you'll probably check your medicine cabinet a little more carefully. 2. The medicine you didn't know was Benadryl. This may be the biggest surprise so far. You check your medicine cabinet. You don't see a box labeled Benadryl, so you assume you're safe. But are you? Here's what many people never realize. The active ingredient in Benadryl, diphenhydramine, is found in a surprising number of over-the-counter products. Not just allergy medicine, nighttime cold remedies, some PM pain relievers, certain sleep aids, even a few products people only take once in a while. That's where the trouble begins. I've had patients look me straight in the eye and say, "Doctor, I never take Benadryl." Then we read the labels together. To their surprise, they were taking diphenhydramine from 2 or sometimes even 3 different products without knowing it. That's more common than you might think. Imagine filling a glass with water. You pour a little from one pitcher, then another, then a third. Each amount seems small, but eventually, the glass overflows. The same thing can happen with medications. You may believe you're taking a small dose. In reality, your body is receiving much more than you intended. And because older adults often clear these medications more slowly, the effects can build up. Extra drowsiness, more confusion, poorer balance, a greater chance of falling, all without realizing why. I've seen this happen with people who were simply trying to feel better. Barbara was 77. She had seasonal allergies, so she took an allergy pill before dinner. A few days later, she caught a bad cold. Before bed, she reached for a nighttime cold medicine because she wanted to sleep through the night. She wasn't trying to misuse medication. She was trying to recover. The next morning, she could barely keep her eyes open. She felt unsteady walking to the kitchen and struggled to stay focused during a conversation with her daughter. When her pharmacist reviewed the labels, the answer became clear. Both products contained diphenhydramine. Barbara had unknowingly doubled her exposure. Once her healthcare team helped her choose more appropriate options, those excessive side effects faded. She was relieved. So was her family. This is why reading the active ingredients on the label is just as important as reading the brand name. 2 boxes may look completely different. They may have different colors, different promises, different advertisements, yet they can contain the very same medication. That's an easy mistake to make, especially when you're not feeling well. The good news? You don't have to memorize every medication on the pharmacy shelf. Instead, make it a habit to ask one simple question whenever you buy an over-the-counter product. Does this contain diphenhydramine? And is it appropriate for someone my age? Your pharmacist can answer that in minutes. That one question may help prevent days or even weeks of unnecessary side effects. And now, we've reached the #1 reason. The reason many geriatric specialists, pharmacists, and primary care physicians pause when they hear that an adult over 65 is taking Benadryl regularly. It's not just about allergies. It's not just about sleep. It's about protecting something every older adult values above almost everything else: the ability to remain independent. 1. Protecting your independence. If you remember only one thing from this entire video, remember this. For most older adults, the goal isn't simply to live longer. It's to live well, to stay in your own home, to drive safely, to enjoy time with your family, to make your own decisions, to remain independent. That's what matters most. And this is why Benadryl has become such an important topic in geriatric medicine. On its own, one dose may not cause a crisis. But when you add together everything we've discussed, the slower aging body, the increased sensitivity of the brain, the higher risk of falls, the possibility of confusion, the interactions with other medications, the hidden sources of diphenhydramine, a very different picture begins to emerge. It's not one dramatic event. It's the cumulative effect. Think of independence as a bridge, a strong bridge. Every healthy habit strengthens it. Regular exercise, good nutrition, quality sleep, managing blood pressure, staying socially connected, reviewing medications. But every unnecessary risk removes a small piece. One piece may not matter. Several pieces might. Eventually, the bridge becomes less stable. That's why organizations such as the American Geriatrics Society include diphenhydramine on the Beers criteria guidance that helps healthcare professionals identify medications that may pose more risks than benefits for many adults age 65 and older. Notice the wording. May pose more risks than benefits. Not never. Not for everyone. Medicine is rarely that simple. There are situations where a healthcare professional may decide that diphenhydramine is still the right choice for a specific patient. But for routine use, especially for sleep or frequent allergy symptoms, many experts recommend considering safer alternatives first. That shift didn't happen overnight. It came after years of clinical experience, research, patient outcomes, and careful review by experts. I've watched this change over my career. Years ago, many clinicians thought of Benadryl as a dependable, everyday medication. Today, when I meet an older adult who takes it regularly, one of my first questions isn't, why are you taking it? It's, what are we trying to treat? Because once we understand the real problem, we can often find a safer solution. Maybe the allergies need a different medication. Maybe poor sleep has an underlying cause that hasn't been addressed. Maybe another prescription is interacting in ways no one realized. Sometimes the answer isn't another pill at all. Sometimes it's treating the cause, not just the symptom. I think of Ruth. She was 83. She came to see me because she was convinced she was slowing down. She no longer enjoyed gardening. She felt tired every morning. Her daughter worried about her memory. Her son worried about her balance. Ruth worried she was losing herself. Instead of assuming it was simply age, her healthcare team reviewed everything. Every prescription, every vitamin, every over-the-counter medicine, every bedtime routine. They found several opportunities to simplify her medications, including replacing a regular diphenhydramine-containing product with a treatment better suited to her needs. The changes weren't dramatic overnight, but over the next few months, she became more alert, more confident. She returned to her garden. She laughed more. She told me something I'll never forget. I don't feel younger. I just feel like myself again. Those words stayed with me, because that's the real goal, not turning back the clock. Helping people enjoy the years they have with the clearest mind, the strongest body, and the greatest independence possible. So if you're over 65, or you're caring for someone who is, take a few minutes this week. Open the medicine cabinet. Read the active ingredient labels. Make a list of every prescription, every over-the-counter medication, and every supplement. Then bring that list to your next doctor's appointment or pharmacist consultation and ask, are all of these still the safest choices for me? That single conversation could be one of the most valuable healthcare decisions you make this year. If today's video has helped you look at your medications in a new way, I'd appreciate it if you tapped the like button. It helps more families find this information when they need it most. And remember, growing older doesn't mean giving up your independence. It means protecting it, one informed decision at a time. Thank you for spending these moments with me. Take good care of yourself. Take good care of the people you love. And before you go, have you ever wondered why something as ordinary as your fingernails can sometimes reveal early warning signs about your heart, your circulation, or even your nutrition? The answer surprises almost everyone. I'll see you in the next video.